and welcome to In Pursuit of. Today's guest is Akriti Gupta, founding member of Win Over Cancer. And she is in pursuit of
enabling cancer patients towards a better quality of life.
Nice. So, Akriti, how do you pursue that? What is it that Win Over Cancer does?
Win Over Cancer is working on 3 approaches of save, support, and survive. Save is around helping cancer patients, actually helping someone to not fall into the trap of cancer, or even if they have fallen into the trap of cancer, to be detected early. So it's about cancer awareness and early detection. Then support, it is about supporting people who have got into the trap of cancer, that is emotional and financial help. And then third is survive, which is helping cancer patients to get back into the society with dignity. So that is under 2 projects, Project Garima, where we distribute breast prosthetics and cancer bras to cancer patients. And then there is a project around skill development and helping them get back different jobs and entrepreneurial opportunities. And then peer support, where we connect them as a community. So we organize a lot of online workshops for people who cannot come, and also practically, it is not possible for a survivor to meet every 3 months or every 4 months, especially if they're not living in Delhi.
In 2022, you received the Diana Award, and which is very prestigious. So what is it that makes Win Over Cancer stand out versus other cancer relief organizations and cancer relief and support organizations?
Firstly, our initiative, particularly around survive, that is how we can help cancer patients to get back into the society with dignity. That is something that we've been focusing upon because not a lot of people are thinking around that. So I always say that in India, we have wonderful doctors, we have amazing cancer infrastructure. And if you see on the affordability side, so firstly, even in the private sector, if you compare it around the world, Indian cancer treatment is the most efficient as well as more effective.
Is that so?
Yes, absolutely. We are one of the biggest hubs for cancer treatment when it comes to medical tourism. So that is there. And when it comes to charitable and government side, so if you go to Tata Memorial Hospital or if you go to AIIMS, if you have an Ayushman Bharat card or if you have a BPL card, a lot of your treatment will actually be done free of cost. But what is really required is guidance. And secondly, we also need to understand that while in the US, we have 1 for 100 cancer patients, whereas in India, we have 1 for 2,000 cancer patients.
That's totally crazy.
Yeah. So the entire ecosystem is extremely overburdened. And cancer is not, a one-time disease. It actually changes. It has a significant impact on your life, be it financially, be it emotionally, be it in terms of how your body is now. A lot of patients suffer body deformity. Right? You lose your hair. A lot of times we have seen the most empowered women who are the role models in their society. They actually go underground during their treatment because they say that now I don't have hair, I don't have breast.
I don't want people to see me like this.
There is a significant hand-holding required for a patient to help them get back into the society. And that support, that bridge, we want to become that bridge. And that is something that we have been doing differently than most organizations in India. So everyone have their own specialization and everyone is working together for that. They say that everyone has their own focus.
How do you measure impact? Is it the number of prosthetics you gave out, the number of people you made aware of, how not to get cancer?
So we have different impact indicators for different projects. So one is definitely about the outreach, how many people we have been able to reach out to. Then the second is also we try to measure the level of awareness. So one of the campaigns that we have been doing is working on measuring how much behavior of a person has changed before the campaign and after the campaign. So there's a pre-intervention survey, there's a post-intervention survey, and a proper analysis around that. But when it comes to Project Garima, again, we have different impact indicators. We've just closed our impact numbers, and we have been able to serve more than 15,000 breast cancer patients with breast prosthetics and cancer bras since 2016. If I say in terms of quantitative numbers, more than 90% patients say that their body image level has increased. Their confidence levels have increased. They've started going out into society even more. And 60% patients said that they have been able to get back to their jobs just because of the breast prosthetic.
Wonderful. So can you tell me some story which, like, you felt was such a major story that it makes you feel that it's really worthwhile doing this?
So there's a story where a woman, she would run a tiffin service business. If you think about a tiffin service, you will think that a woman really need not step out of her house. She just needs to cook and work with a small set of people. I mean, how can a body deformity impact her? But she said that to take the vegetables or to take the ingredients, I would love to go out in the market and pick them myself. And that stopped after cancer. Actually, I had to shut down my tiffin business because of my cancer. And then she said when I got breast prosthetic, again she was able to restart it because she said now I feel confident enough.
So Akriti, tell me, so are these prosthetics and any of the other support, is it only for the underprivileged, or can other cancer patients also get it, and how? I mean, you're an NGO, so how does it work?
So a cancer patient is a cancer patient. They're very vulnerable, and irrespective of the fact they can afford a product or not, they should not be denied of the kind of support that we are providing. From 2015 to 2018, we are just the not-for-profit Win Over Cancer working, but it kind of changed in 2018. It's actually during my research, during my master's thesis, where I was understanding the journey of a breast cancer patient throughout different phases. That's when I interacted with patients and doctors from private hospital, where I realized that while people are willing to pay for these kind of products and these kind of support services, still there is a significant gap. There might be products available, either they're extremely expensive, like the imported ones where prosthetics are starting from 15,000, 20,000, the wigs costing 30,000, 35,000, like that. Or even if, people are willing to pay even this kind of money, they don't know where to buy it from. And just imagine a person who is going through cancer treatment, imagine them and their family members, and they have to scout for these kind of dealers all around in the market. Therefore, I saw an opportunity, and we thought that, okay, let's convert this into a hybrid model where we registered ourselves as a private limited and started Canfem as a parallel organization.
When you say prosthetics and wigs under Canfem, so do you import them? Do you make them yourself here in India?
When it comes to prosthetics, fabric-based prosthetics, it is actually a patented technology. It has been invented by my mother and the founder of the NGO, Akriti Gupta, and we have our own manufacturing unit for that. Similarly, for cancer bras, again, we have all the Indian partners for developing that. The silicone prosthetics, we are importing a particular range, but again, even that range costs about 50-60% of the other silicone alternatives that are being imported from America or from Europe. And when it comes to wigs, so we have a range of products. Again, we have the most affordable wigs. Mm-hmm. Our wigs are made in such a way that they do not hurt a cancer patient's scalp because they have zero hair. Mm-hmm. The skin has become extra sensitive because of chemos or because of radiation. So that is all taken care of.
What does this awareness program of yours do?
Cancer can happen to anyone. Just last week, I was organizing a cancer awareness camp in a slum area. And my first question to them was, is cancer contagious? So a lot of people don't even know what is cancer. When my father was getting his cancer treatment done, I come from a very privileged family. I come from a very educated family. And yet a lot of relatives came and asked my mother, okay, how much days, does he has to live? And all kind of absurd questions, actually. And that's when we realized that it is not that they want us to feel bad. In every movie that we see, they give the main character or a side character cancer, and then eventually that character dies, correct? So that's what we have been learning. So first is definitely about making people aware what exactly is cancer, what causes cancer, demystifying certain true myths around cancer. There was a very big myth that if you wash your head during a certain time of your period, you may develop cervical cancer.
Are you kidding me?
And then the third step is around making people aware about their own body. What are the early symptoms of cancer? There's a one thumb rule that if there is anything abnormal in your body, be it, the way you're passing your stool or if you're having fever, or if you are having anything irregular, if you're losing weight without doing anything, like without working out, or without basically changing any pattern in your life, but you're losing weight significantly, I'm not saying that you may have cancer. I'm saying that you
You
need to
should
go and
get yourself
consult a doctor.
checked.
I say this specifically to women, that how women is the pillar of the entire household. But when it comes to herself, she treats herself as the least priority. When we go in communities, when we go in slum areas or in villages, a lot of cases come in where the woman says that if I go to a doctor, I will lose a day's wage. So you cannot imagine the kind of other factors that impact late diagnosis of cancer. And second is, if you get cancer, then what? So we also have a program where we guide them that, okay, this is the nearest cancer center. We generally partner with the nearest cancer center, and we involve them in our cancer awareness campaigns.
Wonderful. So, Akriti, what is one of the unique challenges that you have as an organization?
It is actually a very unique challenge, because at the end of the day, an organization has limited funds. So for us, the biggest ethical dilemma is when we have 2 cancer patients in front of us and we have funds for just 1. How do we choose? We have certain parameters. For example, I would like to ask you, if you have 2 people to whom you can donate to get their cancer treatment done. One is a child, and the other is a 60-year-old plus man. Whom would you donate for?
I think I would go with the kid, right?
Right. But doesn't that 60-year-old person has the right to get treated?
Absolutely. But I think the child has an entire lifetime ahead of him or her, right? And I think to me, that just feels like that kid needs to be given the chance first. The 60-year-old person has lived their life for 60 years.
Yeah.
Right.
Yeah.
I think that's what. But I think I hear you. If it's like maybe a child and a woman who has 3 kids.
Yeah.
A single woman lady who has 3 children.
Yeah. That was actually my next point.
Then that would be a really hard one, because then there are 3 children and there's 1 child. It's like that.
Yes.
Right. So I hear you. So I think some are easy to choose from and some are harder to choose from.
Correct.
And I fully agree with you. That would be a difficult one. So what's your vision for Win Over Cancer and for Canfem?
Actually, for both the organizations, we have a similar vision where we want to become a one-stop solution for all kinds of non-clinical needs of a cancer patient, be it in forms of product, or be it in form of services, or be it in form of community. The difference between both the organization is that with Win Over Cancer, we work for patients who cannot afford these products and services, and with Canfem, we work with patients who are willing to pay for these products and services. But the vision is pretty much the same.
Lovely. Thank you so much, Akriti. It was so nice to hear from you about your organization. So much nicer to hear from the founding member than reading up about it, because we read about, cancer support organizations and, cancer treatments and everything in the papers and everywhere. But it's really good to know firsthand about some things. And I'll keep it in mind. If I know, people in my, circle, then I'll get them to get in touch with you. So thank you. So keep watching In Pursuit Of while I continue my conversation with Akriti Gupta, founding member of Win Over Cancer.